My name is Dr. Henry Stiene. I practice with Beacon Orthopedics in Cincinnati, Ohio. I've been doing PRP since 2006, and to date we've treated over 1,400 patients in a variety of applications. I started using PRP in my practice a number of years ago because, much like my patients, I was very frustrated at the lack of progress that we were having in treating chronic tendinopathy. I started looking at the European literature. I started looking at the, believe it or not, veterinary literature, where a lot of the initial studies were done. And I also talked to a lot of plastic surgeons. Why plastic surgeons? They were one of the first groups of physicians that actually started using stem cells, not for cosmetic purposes, but for people that needed facial reconstructions. They started using PRP way before we did in orthopedics, and from talking to those physicians personally and reading the literature and listening to their success, I asked myself as a physician, one of the first things that we are taught in an oath that we take is to create no harm to our patients. When you give somebody platelets, you're basically giving their own tissue back and you're accelerating Mother Nature's own healing process. We're not giving them anything that doesn't belong to them. And that's the beauty of it. We don't have to worry about allergy. We don't have to worry about rejection. Platelets by themselves are anti-infective. Plus, if you have a system like Harvest that has white blood cells as part of it, they fight infection as well. So patients understand that. And the thing is, the patients like myself, they understand that a corticosteroid injection really isn't healing anything. It's like putting water on a fire. It puts out the fire, but you still got the burnt wood. The beauty of regenerative medicines, especially PRP, is they help regenerate that burnt wood, in this case an unhealthy tendon, into healthy tendon. I was a believer when I had a runner that came in and saw me a number of years ago and had a very large Achilles tendon nodule. We gave him a platelet injection. He came back about 8 weeks later. I had to check which ankle I was looking at because the nodule had almost disappeared. And I said, wow, something's going on here. So as I learned more about it, both the basic science behind how the body heals itself, how platelets work, how the different platelet systems work, it was something that our patients are very happy with. And where we've had instances where, for instance, people may not be a surgical candidate, we have an option to give them regenerative therapy. Where folks, and I tell folks this all the time, doing surgery on a tendon is not a slam dunk. You need a blood supply for tissue to heal, so if you have some unhealthy tissue and you go operate on it and you take a piece of unhealthy tendon out and you don't have a blood supply, how's that going to heal? That's why we don't like operating on tendons, because we want people to get better. We want to hit a home run or a slam dunk. I've used a couple different systems over the years, and I've really enjoyed using the Harvest system for a number of reasons. One of the main reasons is it's very effective. I find it works very good for my patients. Overall, we have a database that says we have over an 80% success rate in all our patients getting back to their normal function of doing what they want to do, either occupationally or recreationally. The Harvest system works very well for us because when you ask yourself what defines a good PRP system, well, the jury's still out on that, but we have a pretty good idea. Generally, we like to have a platelet concentration that's about 2 to 5 times elevated above baseline. Nobody knows for sure yet the value of white blood cells. I personally have used systems that do not have white blood cells in them, and I have found the system that has the white blood cell as part of the PRP seems to get my patients better a little bit quicker. We use PRP for chronic tendinopathy. We use it for acute muscle injuries. We use it to treat osteoarthritic joints. And we also use it as an adjunct to surgery for folks that have had surgery and may need some additional healing if they don't have very healthy tissue. How many injections do I do? It depends on who I'm treating and what I'm treating them for. The younger you are, the more stem cells you have. Platelets recruit your body's stem cells by releasing growth factors. So if you have a patient with a chronic tendinopathy that doesn't have a very good blood supply, one of the things that we have to do with our treatment is help create a blood supply. You have to have the growth factors that create angiogenesis, which is the development of new blood vessels. So for folks that have chronic tendon injuries, oftentimes they may need 2 to 3 treatments spaced over a period of about 4 to 6 weeks. Sometimes we'll have a younger athlete come in that has an acute hamstring tear or an injury that just occurred a few days ago. They may only need 1 treatment. So the amount of treatments that we do is solely based and individualized to what the patient's needs are and what their condition is. We tell our patients when they come in for their treatment, they're going to be in the office for about an hour. We draw the blood, and it takes a harvest system about 15 minutes to process it. Oftentimes I give patients a nerve block, and then I do my procedure of injecting the platelets under ultrasound-guided needle placement. Oftentimes, if the tendon is very thickened or very degenerative, we do what's called needle fenestration to break up that scar tissue to create a blood supply. And it's a very efficient system that we're using right now, because while I go see one patient and start the treatment, my staff can go in the other room and start drawing the blood from the next patient. So we're able to turn over 2 rooms very quickly and make it efficient for the patients.